I am responsible for ensuring that lunch is served every day at 12:30. I run the Daystation program. I collaborate with both staff and volunteers in ensuring that we have good, nutritious food every day for folks. Identifying the increased need in the number of people we were seeing on a daily basis, and how our food program, a food program would be beneficial, in having somebody dedicated in there creating meals, working with volunteers, and it has been a game changer. I think that the quality of food and the consistency of our food has increased. Our volunteers have increased, and I think that our kitchen is very much one of the main drivers of the people who come into our space daily.
My name is June McIntosh. I'm the kitchen manager at the Daystation. So ideally we have volunteers come in and cook. 7 days a week we're open. If we don't have volunteers sign up, I cook.
With the grant this past year, we have been able to go beyond relying on donations for things like bread in the morning. Previously, we were relying on day-old bread to be dropped off by a volunteer from local businesses, which is, relatively inconsistent.
That some of the people we're working with this is the only meal a day they're getting. They're getting this meal. We want them to get calories, we want them to get protein, and we want them to have this so they can sustain themselves for wherever they may go. 60% of the people we're serving at our Daystation in any given day are sleeping outside and don't have adequate ability to store food, cook food, and just be safe in their community. And so to know that we have a place where you can come get a warm meal and be safe and warm for 8 hours is phenomenal. I think having the adequate resources takes such a mental load off our staff that we are not constantly having to worry about piecing together this and that and providing things that we maybe aren't as proud of, because when we have the resources to have fresh food and be able to offer seconds, or to be able to just say, yeah, we can get you something at 3:30 when you just get off work, it's huge. It's hard to say no all the time. So being able to have adequate food that is healthy, that is nutritious, that is plentiful, takes that mental load off staff so they can do the other supports with service coordination and running the space in a different way than worrying about making sure we have food for everybody to eat that day.
Well, this is like the first time I've been homeless, I guess, in a sense. I was couch surfing before. So I'm just trying to get myself situated, I'll do whatever work needs to be done up here, but I just want to get myself kind of started up again, start working, whatever it is, save some money up so I can get an apartment. First of all, so I'll start with the Daystation, of course. Staff here has been amazing. I know some people here can be a little complicated, not the staff, I'm just talking about the individuals that are utilizing COTS. But their attitude, everybody, from Kevin all the way down to the individuals at the desk, they're just so happy to help, and they do it with enthusiasm and with a smile. You can tell that they're really caring people. So I think that in itself is a good representation of what COTS is as an organization to help people try to get back on their feet.
So we have a lot of services. The basic needs services, I think, are what brings people in most of the time. The ability to take a shower here, the ability to do your laundry here for free, to be able to get your mail. We receive mail for probably 3,000 or 4,000 people, because when you're experiencing homelessness or housing insecurity, you don't know where your mail is going, and trying to rely on general delivery at the post office is just not adequate. So folks get that here. But then the auxiliary services are that we are a space for community partners to come in and support the clients they're working with. And in addition, we are hosting Turning Point recovery programs here to help people get connected to treatment services, Community Health Center, Burlington, to help individuals experiencing homeless or housing insecurity get connected to a medical home, dental care, access to services, medication, social work, and case management support. And we are also the gateway to our adult overnight shelter, the Daystation, which we do the screenings and the intakes here for folks to go to that shelter.